So we have got many such things. If we compare accordingly, that helps us. Okay. Then next is other drug in that class is labetalol, alpha 1 beta, both effect it has got. It is rapid acting, it is non-selective, it has got intrinsic sympathomimetic activity, it has got local anesthetic effect, it can be given orally or intravenously, it does not alter serum lipid or blood glucose, it produces peripheral vasodilation because of alpha 1 also, it decreases blood pressure and comparatively more than propranolol because it is acting on both alpha and beta. So it is used in severe hypertension which is not otherwise controlled, and it is used in pheochromocytoma. It is used in hypertensive crisis which is very severe blood pressure which is otherwise not controlled. It is used in a pregnancy induced hypertension. Adverse effect, since it is able to decrease blood pressure too much, then it can cause orthostatic hypotension or postural hypotension. It can cause sedation, it can cause dizziness. So how this we have to compare on the basis of mechanism of action. Okay. Then carvedilol, it blocks alpha 1 beta, it is non-selective, it has got antioxidant action, but it has not got any intrinsic sympathomimetic activity, no local anesthetic effect. It is comparatively found to be more better in CCF, congestive heart failure, and it reverses its pathophysiological changes. It is also having same adverse effect, orthostatic hypotension and edema. These are the effects or adverse effect these are having. Okay. Then what are the summary? I told you they are useful at many places, but it is not that all are used at all places. So example, hypertension. In hypertension, what are the preferred one? Atenolol, bisoprolol, metoprolol, propranolol. Then again important thing is labetalol is also preferred in hypertension, but in what condition? When it is severe one, it is not controlled, or it is too much and it is not responding to other drugs, we call it as a hypertensive crisis. In that labetalol is useful, or in pregnancies it is useful, or in pheochromocytoma mediated hypertension it is useful. So thus how the drugs is used, it is depending on its mechanism of action and its other pharmacokinetic dynamic things. Arrhythmias, in that normally esmolol is given, particularly for small one. Esmolol is ultra short, only 10 minutes we have seen the half life is. Atenolol, propranolol are given. In CCF, congestive cardiac failure, carvedilol we have seen is a preferred one. Bisoprolol, metoprolol can be given. In myocardial infarction, atenolol, metoprolol, propranolol can be given. Glaucoma, the only one which is most preferred one is a timolol we have seen. Migraine prophylaxis, propranolol can be given. For anxiety, propranolol can be given. Thyroid toxicosis, propranolol can be given. The reason is, as I told you, thyroid, both beta 1, beta 2, alpha, all receptors are there, therefore we are giving. In anxiety, we need the drug should cross blood-brain barrier. In migraine and anxiety, therefore we are preferring propranolol. So this is how drugs are there. This is what table we can have. What is the basic, like this table you can make, you can add the things, pharmacokinetic things, basic mechanism is common, and what are the typical things, like that tables you can make, and where these are used. So this is how we can have the details regarding beta blockers. So go through this, have these details in your mind, and if you have any doubts you can ask. Okay. So here we have finished beta blockers. As I told you, now we will not discuss anything about beta blockers again. Now actually beta blockers were part of our ANS. At that time we have not discussed in more detail. Beta blockers are the part of our hypertension studies. Here we have discussed it during hypertension. Beta blockers are there which can be discussed during angina pectoris. Now we will not discuss about beta blockers. Beta blockers are used in arrhythmias. We will not discuss in arrhythmias. Beta blockers can be used in some of the congestive heart failure. There we will not discuss beta blocker. I hope this is clear. Okay. So once we discuss somewhere, it is for or, it is same thing is there in ANS, same thing is there for hypertension, same thing is there for other thing. So here we have finished beta blocker with all the details. So go through this, make similar or better tables which will help you to understand. Similar tables are actually given in many books like Rangandale and Goodman Gilman, and definitely it can help you in understanding. Okay, but for that, if you'll read text and then you will make the table, or if you'll modify the table, it will be helping you. You can have your own notes with it and understanding about it, that why this is there. So with reasoning, if you understand, if reasoning if you will do, definitely your pharmacological base will be better and you will be having interest about the subject. So try your best, make it that way, and if you have any difficulties, we can discuss it any time. Okay, so take care, have a good time. Tomorrow probably we may not have a lecture because tomorrow that holiday is there, some other activities are going on in the college. I may not be able to have a lecture. Okay, so take care and be careful about it. So we'll meet on Monday only. Okay.